The NHS is to declare that sex is a matter of biology in a landmark shift against gender ideology. Changes to the Health Service's written constitution proposed by ministers will for the first time ban trans people from women-only wards and give women the right to request a female doctor for intimate care. Well, the new constitution will state we are defining sex as biological sex, and we're going to have a debate on this. And joining me now to debate it is the human rights campaigner and the activist Peter Tatchell, and the co-founder and the CEO of Sex Matters, Mayor Forstater. Welcome to the show to both of you. Mayor, may I start with you? You no doubt think this is a long overdue welcome back to common sense and reality, don't you?
Absolutely. If there's one place where people should know what sex you are, it's when they're dealing with your healthcare. It's crazy that the NHS has not been recording people's sex. Somebody might be non-binary and that's fine, but the hospital still needs to know whether they're male or female. And when it comes to putting people in sleeping accommodation in wards, women want to have single-sex spaces. They want to have privacy and dignity. And that doesn't mean the NHS can't also look after transgender males, but it can't do it by placing them in the women's ward.
And Peter Tatchell, do you think this is fair enough? I mean, when women are at their most vulnerable, at their weakest, in hospital, they deserve every protection that the state can offer. And it seems now the NHS concurs.
Well, let's face it, this is a pre-election stunt by the Conservatives designed to stir up and inflame culture wars, and they're using trans women as political fodder, which I think is pretty disgraceful and pretty low. But of course, it's true that biological sex is a fact, it's a reality, and it's very important because men and women biologically do present with different illnesses and different symptoms. So it's very important that hospitals know who is biologically male and female. So I've got no worry with that at all. Likewise, when it comes to hospital ward provision, the easy way out of this is to simply assign trans patients to a private room, or if there are several trans patients in the hospital, to set up a specialist trans ward. That way, women will feel safe and comfortable, and so will trans people. And when it comes to women patients wanting to be treated by a female doctor when it comes to intimate care, that's been a long-standing policy, and I support it.
But is that enough for you, Mayor? Because anybody who knows hospital wards knows that a private room is on the ward. You can open the door and walk around. It's not keeping the ward secluded. It's not keeping the ward safe from potential danger. It's simply putting people behind a closed door, which they presumably will be free to open.
Absolutely. And private rooms are used for all kinds of things. They're used for end of life. They're used for infection care. It has to be a clinical decision as to who is using a private room at any one time. So that can't be the answer. The answer has to be, in the first place, are people considered as having a sex, which is an objective reality, or are they allowed to choose whether they're treated as men or women? And currently, the NHS says if somebody identifies as non-binary, so they don't need to have done anything whatsoever, perhaps chosen they, them pronouns, a man can choose to be placed in women's accommodation, in the women's ward. The idea that a man who has they, them pronouns should be in a private room of his own is ridiculous. The NHS doesn't have those resources. So first thing it has to do is be clear that patients are male and female, and doctors are male and female, nurses are male and female. So if they're going to offer patients a guarantee that you can ask for a female healthcare professional, then they need to be able to know what sex their doctors are, and be clear to the doctors that the patients are not there to affirm their gender identity.
And Peter Tatchell, briefly, if we could, the CAS report came along, a globally acknowledged breakthrough for the women's rights activists, and now the NHS is following suit. Do you feel that the trans activists, the ideology that you support, is losing its power?
It's not about trans activists. It's about love and care and compassion for trans people. And there's absolutely no proof, no evidence that trans people in general are in any way a threat to women in any circumstance, including in hospital. And there are private rooms that are off wards, that are separate. That's a perfectly acceptable solution. Or, as I said, to have specialist trans wards. We can find a solution. We have to look at this in a way that respects women's rights and trans
Peter
rights.
Tatchell, I'm afraid we have to leave it at that. And Mayor Forstater, I'm afraid we've simply run out of time. A superb debate.